There you go. All right, we are recording now. All right, cool. So this talk, I want to kind of talk, bring in the theme. There'll be a big theme around here about it takes a village. I kind of pulled this from Wikipedia. It takes a village to raise a child is an African proverb that means that the entire community of people must interact with children for those children to experience and grow in a safe and healthy environment. Through my experiences of being a outreach worker and a case manager, I've realized having folks in the local community who can really step up and do what they can to do to help my clients really makes a difference in terms of their recovery process. The whole idea of us like becoming a village is like, how do we figure out how we work together? You know, the ideas that are coming out like mutual aid, solidarity, economics, direct action. So here, if you're here for that, and if you're interested in sort of experiences around that, you know, you came to the right place. I'm going to ask a few people here that are joining us to maybe introduce themselves, a little bit about their background, a little bit about me. My name is Joe. My pronouns are he, him, they, them. My job description right now, I'm an outreach worker and case manager. So I go to homeless encampments in the Northeast Los Angeles area. This is like Boyle Heights, Highland Park, a little bit of East LA, Eagle Rock, Atwater Village, all Northeast LA. And right now, because of COVID-19, we're focusing a lot of outreach and encampments and testing folks. So we go out there with nurses and we directly test folks, check up on them. If they're positive, you know, we'll offer them a chance to get into one of these quarantine locations. Or if they prefer to stay where they're at, we'll come visit every day, bring food, bring anything that they need. So we're really taking this whatever it takes approach. What got me interested in this field, I've been volunteering since since like 2012 with a group called Monday Night Mission. We used to feed folks on Skid Row every night, Monday through Friday. From that, we started doing some political organizing, going up to the state, the Senate, everywhere we can do to try to lobby for more funding and to declare an emergency on homelessness in California. From that, the group turned into the Showers of Hope, which I'll go into a little later. Showers of Hope provides mobile showers all around LA County, a great opportunity for folks to get resources that they need, take a shower, meet people. And then from there, I got a job as one of the Measure H outreach workers. So that's been great. Just kind of seeing like the whole community approach to now how the county approaches it. You're going to learn a lot about what the county does and doesn't do. So we'll kind of dive into those realms. And what I do for self-care, I garden, I write music, go hiking. So that's very important. And especially if you're going to do a lot of this work, knowing your self-care, what do you want to call toolbox is very important. I want to see if maybe Joey, if you'd like to introduce yourself. You're one of the folks here with the background and experience. So feel free to unmute yourself, maybe if you want to introduce yourself.
All right, can everyone hear me?
I can hear you.
Okay, first, I can't see myself, so how do I look? Just kidding. Okay. My name is Joey. My pronouns are she, her, hers, they, them. Currently, I am a program manager with the LA County Department of Health Services, part of the COVID response team. Last week, I was an outreach and generalist worker for homeless services with the People Concern out of SPA 4. We'll get into spas, I think, but servicing areas like Mid-City, Midtown area, the city of Los Angeles, parts of Hollywood, and parts of Skid Row as well. I've been doing that for about 3 years now. What else? What got you interested into it? Okay, sorry, I'm like all over the place. With this new job with the COVID response team through the LA County, I'm essentially doing site visits to all shelters. My area is going to be Skid Row area, so I'm visiting all of the Skid Row shelters, basically trying to see if they're implementing COVID safety procedures, what they're doing to keep all the clients there safe, if they're keeping the staff safe, doing outbreak testing, surveillance testing, and contact tracing also. Basically, anyone who tests positive and making sure, you know, who they came in contact with and making sure those folks get tested or get quarantined. What got me into this is I'm an LA native. I was priced out of my home in along Melrose and Western, and my folks moved out to the San Fernando Valley. They're now in Sylmar, closer to Pacoima than Sylmar, but I guess the borders they set up were in Sylmar. And so I just wanted to do this because I know what it's like being displaced out of my community, not knowing, you know, what resources I had, and what I had were available to me. And I really empathize with the experiences that a lot of our unhoused neighbors are experiencing. Yeah. So what do I do for self-care? I try to stay away from work as much as possible. I have to separate work from my personal life. I also practice Muay Thai on the side as well. So a lot of exercise just to kind of get out of my head sometimes and be more physical. Is that it? That's it? That's good, right?
Yeah, that's good. Yeah,
Perfect.
we'll go into other questions later. Thank you. All right. I think this is Andrea. Andrea is someone I work with. If you want to introduce yourself, name, pronouns, job description, what got you interested, unmute yourself and introduce yourself.
Hi guys, my name is Andrea. I work with Joe at Exodus Recovery.
I think you
Hello?
unmuted yourself.
I think, sorry, I got disconnected.
Oh, no. Okay, you're good now.
Okay, I can't see anything on my screen though.
Oh, let's see. So your name, pronouns, job description, what got you interested in working in this field, and what do you do for self-care?
Okay, perfect. So my name is Andrea, one more time. I work for Exodus Recovery. I'm Joe's coworker. I'm part of the homeless task force. I work on the hospital grounds, and I
think you're breaking out.
It got
I think you're cutting off.
disconnected again. I'm so sorry. It's probably my Wi-Fi here. I go by she, her, and can you guys hear me okay?
Yeah, I hear you.
Okay. So pretty much I take referrals from the hospital and also from our urgent care next door. What got me into this population, I used to work with children, but I kind of wanted to expand my experience, and I was very interested in the homeless population, and I've always liked to give back to the community. So it intrigued me, and then one of my coworkers was already working here, and she just told me like, oh, it's available. So I just took the chance and I did it. For self-care, I like to get massages once a month, mani-pedis, and just relax. I've gotten into meditation, which has helped me because just, I don't know, calm myself, and it's helped me a lot. So it was nice meeting all you guys.
Awesome, thank you. And Julio is part of the Young Warriors. We've met, we've done actions, we've gardened. Very, very amazing person. He's the one that reached out to me to kind of organize this. Julio, if you would like to introduce yourself, and I guess if you want to answer any of the questions too, feel free. But yeah.
Hello everyone. Yeah, my name is Julio. my pronouns are he, him, his. And yeah, I talked to Joe just because uh, I had heard something about in the class about um like some people that we just ignore, and so I was just really tired of like ignoring like my unhoused neighbors, and I knew that Joe worked with unhoused people, so yeah, I reached out to him on advice about like doing outreach and talking and connecting with them, but like in a COVID safe way. And he said he'd be down to like go with me, and I was like, hey, like that's like really sick. So then that's how that ended up happening, and that's how everything ended up coming. So yeah, I'm really grateful we're all here and we're having these conversations, and hopefully on Sunday we get out there. So yeah, thank you all for being here.
Awesome. Thank you, Julio. So a little bit about it, because I essentially would like out of this meeting for folks to know what we do, because I think a lot more community members can do what we're doing, can get more involved. And then obviously we're going to go over a little bit of like safety, and self-care is very important because we work with a lot of times with people who are traumatized, and I mean chronically traumatized, either mental health, substance use, physical health disorders, because being on the street, I mean, you can only imagine it's very stressful. So some of that stress, we need to, for ourselves, those who want to be advocates and those who want to step up, it's important that we also know the tools and have a toolkit ready for us to take care of ourselves. Maybe if Joey, if you would like to a little bit go about what is your typical day-to-day like routine where you work at, like what do you do at your job, and then I'll ask Andrea as well afterwards.
Sure. Sorry. So I just started a new job with the county this week, but last week my job was an outreach worker for the People Concern, and it's a nonprofit called People Concern. Day to day would be very similar to what Joe did. We actually met at a training that our job sent us to at Pacoima Library. And so day to day looks like me and my team, mostly just me by myself, going out to outreach folks in general spaces, public spaces that would involve libraries, parks, bus benches, places where they can legally take up space. Outreach with them, try to engage them, build rapport with them, see if they need any services, if they want housing, or food, or whatever they feel they need. And then I come in and either I take them on to as me being their case managers, and then at that point I would help them either get into a shelter or directly into permanent housing. I think I talked about what I do now though, right? Oh, also I work at a women's shelter. I forgot to mention that. I work at a women's shelter for women experiencing homelessness. That one is a little different because I'm not doing outreach. I'm doing just housing for women, just getting them from a shelter into their own apartments via a Section 8 voucher, a Brilliant Corners voucher. I guess we'll go over that, the differences between the two. The differences between different types of housing that are available for folks experiencing homelessness.
Awesome, thank you. Andrea, if your internet is good, would you, what is your day-to-day routine, and what is it that you do at your job? Okay, maybe her internet's down again. We'll go back to her. I kind of explained a little bit about what I do. Again, before the whole COVID pandemic, I would outreach. I'm a generalist, public spaces, so I outreach public spaces, meaning I will go to parks, libraries, metro stations. So part of my job is also building rapport with these facilities, building rapport with the staff at the parks, the libraries, and the metro stations, and finding the encampments, and just, you know, person by person, engaging them, getting to know their name, getting to know where they come from, listen to their stories. That's also something I try to emphasize too, is just learning their stories, like learning what they generally are interested in. It is a lot. I mean, we have our own personal lives that we have to deal with. But for me, you know, I'm working in the community that I live and grow up and participate in. So sort of work is never ending. But I like what I do. I love what I do. So yeah, once I meet someone, I would typically try to figure out like what's their physical health needs, what's their mental health needs, substance abuse needs. I'll go into that a little bit later, but linking them to the right services. And then let's say they get into physical health, mental health, or any of those services. There's specific types of housing programs linked to those services. So my job as a case manager is just making sure, like, all right, we got all the documentation filled out. If they need to work on getting some income, there are also services around that we'll jump into. And these are the linkages that essentially folks can do. Before I had this job, I've already were like talking to folks on the street, getting to know who they are. Sometimes I'll even take them to the doctor's appointment. This is before I had this job. And now I realize, like, yo, there's easier ways of doing things, and these are crucial ways of getting people who are local. If you feel comfortable and are doing it in a safe way, you can help them get linked to a doctor and something. Chances are they haven't been getting the treatment already. So through the housing, again, it's getting the documentation and all that ready. Now during COVID, we're, like I said before, we're mainly testing folks. And again, if they're positive, we'll go out there, provide them food and get them retested. And if they want to get into quarantine sites, there are quarantine sites there. Some of you might have heard of Project Room Key. This is a lot for folks who have chronic health conditions and are about like 65 years old. Those are typically the folks that they prioritize. And so they get to stay there, they get fed. And from then on, you know, we just try to work with them. And if an opportunity comes out, a permanent housing opportunity comes out, we're there to help fill out that paperwork and stuff. So it's a little bit of what I do. It's a lot more stressful than the way I explained it, but yeah. Andrea, are you on here? If you can, maybe go a little bit about what your day-to-day routine is like and what you do at your job. Okay, I think we lost her again. All right. Well, when she comes back, she's texting me right now too. When she comes back, we can ask her about that. Joey, I think you talked about this maybe a little before, but what was the process of getting people housed before COVID-19?
Before COVID-19, it took someone about, I would usually say 9 to 12 months to get housed. So from the first moment that I meet them on the streets to getting them document ready, meaning they have to have their ID, they have to have a social security number or a social security card and some form of income, getting that all in order, waiting for what we call a match. So every individual that we meet, we have to do what is called a coordinated entry system assessment. It's basically 40-something questions where we talk about their history of homelessness, their risk of exploitation, if they've had, or basically like if they've been manipulated in any way, if they, you know, have any legal issues, have anything to do with money, where they're not good with handling their money, if they have any physical health conditions, any mental health, substance use. So it covers almost everything that could possibly impact a person's ability to maintain their housing. And it arbitrarily spits out a score. The highest score you can get is a 17. 17 if you're 60 years old or over. And then if you're under the age of 60, the highest score you could get is 16. Right now, what we're seeing in the service planning area 4, SPA 4, which is pretty much city of Los Angeles, they are prioritizing folks that are scoring anywhere from a 15 to 16 and 17. And that process can take, again, can take months. I feel like there's like so much that I'm trying to cram into this little like brief overview, but essentially anybody who scores 15, 16s, or 17s, they're essentially put into a pool of other individuals, 60,000 other people in Los Angeles County who are experiencing homelessness. It basically raises a red flag saying, hey, this person who scored a 15, 16, or 17, they're super vulnerable on the streets. They shouldn't be on the streets. We have to get them housed quickly. So there is someone who's a matcher for that area. They essentially match the individual to housing subsidy or housing opportunity. So what I mean is, once I meet someone on the streets, I do a CES assessment with them to see what their score is. They get put on what you may call like a wait list, sort of, until they get matched to a housing subsidy. That housing subsidy will be either a Section 8 voucher, which most likely it almost is. One of the barriers to that also is, like I said, one of the requirements is having an ID and a social security card. So this really is not an opportunity for undocumented folks. So they do have other housing subsidies that are specifically for undocumented folks, such as Brilliant Corners. However, they're very, very limited, and there's not a lot of subsidies that are available to the undocumented population or community. What else? Pre-COVID, basically it was, you engage with someone. I still have clients that I've met over a year ago that I'm still in the process of getting housed. It's just a very, very long process. The housing system that the Los Angeles County has set up is not effective. There are a lot of barriers. Things like, when you're essentially on the streets, you are surviving on the streets. So trying to maintain your important documents like your ID and your social security card, even your medication if you need them. Things get stolen all the time. Things get lost all the time. So sometimes you'll work with a client for months just to get their ID and social. And then maybe one bad night or morning or what have you, they accidentally leave their backpack on the bus and they leave, and then they lose everything and you have to start from scratch all over again. It's just not having a stable place to start from to get them into an even more stabler place. Did I miss anything, Joe? I don't, probably a lot, but.
No, that's good. I know there's a lot to explain.
Yeah.
And I think adding to the barriers, because this is something hopefully, I think people might be aware, but, when our clients have to get their documentation, I remember the first time I outreached, I was witnessing a street sweep cleanup. So this is when an encampment, the LA sanitation comes in, usually with the LAPD or the police come, and they're essentially are like, hey, you got 15 minutes, maybe 10 minutes, maybe less, to get all your shit and, get out. And sometimes they'll get their stuff if they're not there and just throw it away, just throw it in their dump truck, which means our client lost all their belongings, which means all that work of getting their IDs and documentation ready, we got to do it all over again. And then we also have to take care of our clients, talk to them, calm them, be there for them emotionally, because, losing your stuff, that's traumatic. And there will also be a focus on here too, to try to practice more of a trauma-informed care. And as you'll see within the system, either you've seen it online or witnessed it firsthand, we don't practice that. We don't really take into consideration the trauma that people have with them, or what trauma essentially can do to folks. So those are some of the barriers. And then obviously the bureaucracy, the red tape. It takes like Joey was saying, it takes 9 to 12 months, even further. I heard even 15 months. I heard even almost 2 years for folks just to get housed. And this is because, you know, the NIMBYism, right? There's a lack of I don't want to say there's a lack of housing, because we do have a lot of vacant properties out there available, especially like in El Sereno. If anyone's aware, there's the whole reclaim homes movement going on, which a lot of people are just basically squatting these homes. And if you go down the street in El Sereno, there's about 12 homes on one block that the Caltrans owns and aren't on the market. This is the whole, they're just trying to push for the 710 freeway to be extended. But these houses are essentially being hoarded by the Caltrans, and folks are just tired of it because prices are increasing. People are getting pushed out of their communities and they don't want to leave, which is important because, well, we live here. You have a community. It's not as easy as just leaving. NIMBYism basically means not in my backyard. So a lot of folks who come out against shelters being in their communities or housing being built in their communities, you know, they're thinking that there's going to be a more higher crime rate, or there's going to be just higher negative behaviors that folks just don't want to see. And obviously this is a political issue, which I mean, arguably, right? It's like, well, there's a housing, people need homes. These are people already on the streets in their community. So what's the difference from them being on the streets to them in your community to them being into a shelter or into some kind of transitional housing site already in your community? So that's a whole talk. But these were some of the barriers. So this is why we're glad folks are in this call. You can kind of see just from our experiences of what we have to deal with, some of the barriers, some of the limitations, and maybe even we're going to go over some of the good examples. I had examples where folks, local community members, were straight up, one person I met, she took in 3 people to live with her. So, and then I had another experience where someone, a church pastor, allowed for folks to stay at the church, and he built showers and all that. So while folks are staying there, I can work on getting their documents ready. I can work on getting their housing process going. And while I'm working on that, they're at a place that's safe, and you know, they're able to get everything else stabilized. They're able to make doctor appointments and all that. So just shedding some light on that. Did you have anything else you wanted to add? Yeah.
Yeah, can I actually add something? In light of the recent protests, I do want to add that systemic racism is a huge factor to homelessness, and even a barrier as well. We know that a large number of the folks experiencing homelessness, I think like 30 to 40% are African American or Black. And we're seeing even Leimert Park, Compton, even South LA, some parts of it are being gentrified as well. And so some of the things that I know I've noticed a lot is, you know, most of my clients were Black African American. If I sent them to the DMV to get their ID, a lot of the times based off their appearance and even their their skin color, it does determine how the DMV worker will work with them, or how they what's the word I'm thinking of? How they talk to them. But if I'm with them as an advocate, me being a Filipina, being a woman, being you know, someone with a badge, that privilege that I bring with me, saying, hey, I'm an advocate for this person, I'm working with them, you know, treat them with respect. Sorry, I got a call in the middle of talking. Yeah, so those are some things. And then of course our LAPD has been an issue as well, like Joe had said, when they do these cleanups, these street cleanups that they do. I've had multiple run-ins with LAPD. Yeah, so there are a lot of barriers because we're essentially working with a community that people often kind of disregard and kind of have ostracized, don't even consider them a part of the community. I had a conversation with council district, I think it was council district 2. One of the guys was like, hey, I just want to keep my constituents happy and the homeless people happy. So we have to find some common ground. I told him, aren't people experiencing homelessness your constituents too? So why is there a divide? And so you can see even politically that there's just a big misconception and disregard for the lives of these folks. But yeah, thank you.
I could share with that too. I remember when I first started, again, I outreach parks, libraries, and like metro stations, but mainly parks and libraries. And I try to build that rapport with the staff there. But I started taking notes of like who's really an advocate and who's not. And it's mainly been about like 50, maybe 60, 40, 60, meaning that they see people experiencing homelessness as just nuisance, as not your normal, quote unquote, normal community members that are enjoying or being at the park. And then maybe 40% are like, yo, how can I help? And they actually will call me, they'll email me, letting me know, hey, there's someone here at the park that I need, that, you know, can you help them? Is there any way we can help work with you to try to, you know, help them? So just letting you know that the landscape that you're dealing with, you know, you've got restaurants, you got other folks who are stakeholders in the community, but definitely their perceptions of people experiencing homelessness is a landscape we have to try to navigate. And it's just kind of been sad, you know, when you see folks just not getting the help that they need just because of perception. And there's a lot of research, a lot of literature out there just in general of how folks that are in poverty oftentimes have a lot of stigma against them. You know, people take the person blame approach, right? It's like, oh, it's their own fault why they're on the street. It's their own individual behaviors that led them to be on the street, rather than, like we're saying, most of our clients are Black and brown folks. So this is an issue of systemic racism, just as, you know, folks that are trying to get housing right now because of the history and legacy of like redlining, even far back as the colonization, it created this landscape again that's hard to navigate to try to get housing and try to secure that housing. And having housing is an important factor in terms of boosting your social mobility. You know, having enough to save up, having assets and everything to collect and, you know, build your wealth. So the fact that we have cost of living rising and gentrification and everything going around with us, right? Because we got to remember we have a lot more in common with people experiencing homelessness than we do with billionaires and all that. So there's a whole talk behind that. So just wanted to highlight too the similar experiences. Did you mention, Joey, where actually what specific areas you outreach and spa for?
So I do Mid-City. I don't know if you guys are familiar with Mid-City. Like I outreach to general spaces also, like Joe, like parks, libraries, and bus stops. These are places that are, you know, not private property where folks essentially can't get kicked out. But in Mid-City, Hollywood, historic Filipino town as well, which is, you know, kind of being swallowed by Silver Lake. I think there was an attempt for gentrifiers to call it South Silver Lake almost. So that was kind of upsetting for me and as a Filipina. And then because a lot of the shelters are in Skid Row area, we would essentially be bringing folks to the Skid Row to get them sheltered there. But what you will find is that folks have different, we want to give every person that we work with the power of choice to decide where they want to be housed, where they want to be living in a shelter. If they don't want to go in Skid Row, I'm not going to force them. It's going to be up to them. But maybe this is a different talk, like a history of homelessness and why all the resources are in Skid Row area. But yeah, main question was I usually work in the Mid-City area. So city of Los Angeles, pretty much. Sorry.
No, I know there's a lot, so we're trying to pack it all in here. So I'm gonna read because Andrea had texted me sort of her responses to some of the questions. And again, Andrea works with a team called the HTF team, so Homeless Task Force team, which survey and outreach all around the LA County Hospital in Boyle Heights. So her typical day-to-day routine is around in the morning, within a 5-block radius, which includes the hospital grounds, the ER emergency room lobby, the pharmacy lobby. She outreaches those areas. They receive referrals from the hospital. So like if someone comes in and they're staying in like one of the urgent care facilities or like the emergency room, or or staying or inpatient, meaning that they're staying overnight, and are homeless, they'll go out to the patient room, talk with them, ask them about their history of homelessness, see what services they can get them connected to. And then she also outreaches our urgent care center. So we basically have like a psychiatric emergency care center where folks can come in if they're having some psychiatric emergency. They could get their psych meds there. There's 5150 holds, which means, someone who's a danger to themselves or others, they can stay there 3 days. Usually the police or some like a mental health clinician will make that referral and they'll come in and they'll stay. But they basically a lot of people use it because if we have a client who needs mental health services and they haven't had a history or haven't been linked to any mental health services, you can take them to our facility. They can wait there for 3 hours, 4 hours, because it gets packed. But they could get their psych meds right there and then. So they outreach that area as well. They explain, Andrea says they explain a little bit of the services and provide them the option of treatment. And then that could include like detox, like if they're substance users, they can get referred to like detox or outpatient or inpatient treatment programs. She says, Andrea said that the process of getting people housed before COVID is mainly building that rapport. And then like Joey was mentioning, like enrolling them into the program and doing the CES, which for some of the folks who just joined in, the CES is basically like a survey asking questions about people's history of homelessness, their mental health, their physical health, their substance use, anything like that, emotional, everything like that. And they get ranked this arbitrary score. And based off that score, it determines sort of like the severity of their homelessness. And I'm not getting too much into the talk, but basically it's hard. It's easier to change. This went from hard to easy. It's cheaper to get folks who are using expensive healthcare services. It's cheaper to provide some type of transitional housing for them than letting them stay on the streets and continuously using expensive healthcare services, which just, it all boils down to money. So it's a lot cheaper for them to get off the streets than for them to continuously use the ER and go basically just rotate in and out of the hospitals. So there's a program called Housing for Health, which I can explain a little later, but it's a program where folks can get into a transitional housing site because they often use the emergency room or have a lot of physical health issues that will be expensive. So it's a lot cheaper just to get them in some kind of transitional housing site. And Andrea was saying that they work towards getting their IDs and then linking them to mental health services, physical health services, getting them to connect to a primary care physician. Andrea mentions that how is it now because of the COVID-19 pandemic? It's been very slow. I remember in the beginning of the pandemic, the whole lockdown, we really couldn't do anything other than just provide food. And now that we have the Project Room Key referrals, we can offer that, which, these are hotels. And let's see what else you said. Job, but are homeless because the rent was raised. Yeah, sometimes the referrals from the hospitals are folks who haven't been chronically homeless. So chronically homeless usually means this person was living on the streets literally for like about a year or so, which is another issue because it's like someone can just be on the street for a week and before they wouldn't really qualify for like housing or anything like that because they're not chronically homeless. So just the technicalities are kind of weird, trying to be case managers and all that.
Chronic can also mean if you've experienced 4 or more episodes of homelessness within the last 3 years. So like Joe said, if you had been homeless for, if you've been couch surfing for a few weeks and then you were out on the streets and then again on the streets and then you bunked up and lived with a friend for a little bit and you've had 4 episodes, or did I say 4 or 3 episodes? So going back basically in and out, having unstable housing for the past like 3 years can also be considered chronically homeless.
Thank you. Yeah. So different definitions, but all the same revolving around chronically homeless. And if anyone has like more questions, I mean, feel free to, or comments, feel free to type them in the chat box. I'll read them, or Joey will read them. One of us will read them and answer them along the way. But now that we kind of shared some of our experiences, we could talk about engagement. So those of you who are interested in what we can do, what you can do to help someone in your local community, someone that you've been around or seen around in the area, or like El Sereno, a lot of folks are becoming more aware of the encampments growing on Huntington Drive. And a lot of people want to do something. A lot of people want to figure out ways they could help these folks. So I think it helps knowing how the county services work or don't work. So like I was saying earlier, I had a lot of positive experiences when local communities members step up and help my clients. So we can start now. I'm calling this engagement and case management. So hold on, we got a little comment. How do we connect folks with chronic medical conditions to Project Room Key? Can you give a brief explanation of red light? Oh, okay. So how do we connect folks with chronic medical conditions? I'll jump into that a little later. There's a thing called LA Hop, or, V, since I kind of know you, you can ask me directly too. And anyone in here too, I'll share our contacts, or share my contact if you want to ask more questions too, because I believe this information is so important. Did you have something to say, Joe?
Basically, you want to connect them to an outreach worker. Their outreach workers are essentially, frontline defense. They're on the ground. So they are prioritizing referrals coming from outreach workers than they are from other homeless service agencies. So Joe will go into that also, how you can get them connected to an outreach worker.
Yes. So that's the privilege that we kind of carry, is that we're able to just sign the referral and get people connected through that way. It's all bureaucracy, folks. So documenting, all that, we just sign it off. And redlining, just to answer that quickly, but hopefully not so quick that it oversimplifies the issue. It's basically, redlining is there's zoning laws and there's development interest. So essentially certain communities, which were predominantly Black and brown communities, they were zoned as areas where they wouldn't give bank loans and all that. And these loans would be for housing. So a lot of folks through these redlining practices, years ago, decades ago, but it still affects us now, weren't able to purchase homes or anything like that. So with that, you have a lot of people within generations that weren't able to purchase homes. But guaranteed, folks, go out there and do your research on that, learn about it. There's a good book called I think The Color of Law. You can check out. So I think the first thing that surprised me as an outreach worker was the fact that LA County is divided up in SPAs. So these are service planning areas. Service planning areas, which I'm gonna pull it up right now so you guys can see. All right, let's see. So LA County is big, which I didn't even know it was that big. Because for me, I've probably only been around right here, this area. But there's whole Antelope Valley, there's whole Angeles National Forest area, Santa Clarita, all that. And it's divided up in sections. So I stay in the SPA 3 area, which is like San Gabriel Valley, Rosemead, Pasadena, Alhambra. And then this is where we work at Spa 4, which on this end, you know, you see El Sereno, Mount Washington, Eagle Rock. This is sort of like my turf right here, and Joey's turf is like right here. Then you see, I guess, the San Fernando Valley kind of areas all right here. And if you didn't know, we all work in different areas or different spas, and depending on where you're at, you'll get linked up to services that are specific to that area, right? So eventually you'll see kind of like how that plays out in terms of getting people linked up to services. Let me see. And then so there's different types of populations. Again, because it's bureaucratic, there's going to be categories on like the people we serve. This was just a few that I pulled up. There's adults, right? So if you see someone who's like an individual adult, they would get linked to adult services. And then if there's families, like women with children or married people with children, they could get linked to family services. And then youth. Do you know, Joey, do you know the age group around the youth for TAY services? TAY means transitional aged youth, but do you know the age group?
Yeah, 18 to 24 years old.
All right.
And usually what we'll see is foster care is a pipeline to homelessness. So most children who age out of foster care usually end up becoming homeless, and will receive services under TAY, transitional age youth, up until they're 24. Then they age out of that and then are considered a single adult.
Yeah, which in my experience, you know, sometimes you get folks that are 23 and then, you know, they basically get cut off, or they're turning 25 and then they'll get cut off, and then now they're linking to adult services. It's the same kind of issues with, like, you know, defining homelessness, right? So you have, it's either 4 episodes or that equal to 12 months, or someone being on the streets for a year. So there's a lot of categories, a lot of definitions, and eventually, you know, you'll pick up and be able to learn them. But this is a resource which I'll share after this meeting. These are some service providers listed by SPA. So if you're in the San Fernando Valley area and people are looking for homeless services, they can reach out to Alley Family Housing. Here's the number. If you're in the San Gabriel Valley area and you're looking for homeless services, usually it's the Union Station Homeless Services. There's the number, it's SPA 4, and this is for family. And then for adults, right? So like people 25 and older, these are the service providers you can reach out to who are fit this category. And then for youth, again, this is divided by SPA. So, and then again, if you're looking at SPA, this is the category. So based on the location, you can look at what spas coordinate with that location, and which number and service providers you can reach out to. So that's just the bare bones right there of like, how do we engage? If I see someone, you know, and they're in my area, what area am I in? Oh, I'll look at which spa I'm in. What service providers in that area? I'll look up their number and see, you know, how can I get this person connected to those services. I'll talk a little about Alley Hop later too, which helps a lot in terms of getting people connected to services. It's give or take, because Alley Hop is also kind of slow. And anyways, yeah, there's a lot of we could dive into so many different conversations here. Is there anything else maybe you want to add, Joey, to this, or is this all pretty good?
Sorry, yeah, it looks good to me.
Cool. So we kind of get an idea of the way LA County services are divided up based on your location. You know, now you kind of have an idea of who to outreach, who to talk to. But there's the model, right? So like we were talking about, there's stigma, there's trauma, there's so much misconceptions and preconceptions that we carry when we're trying to help folks who are experiencing homelessness. I don't know if this is just best practice in terms of all agencies, all service providers, but in my agency that we work at, we take on the biopsychosocial model in terms of helping folks. So the biopsychosocial model right here basically says it's a model it's an interdisciplinary model that looks at the interaction between biology, psychology, socio-environmental factors. The model specifically examines how these aspects play a role in topics ranging from health, disease, health and disease models to human development, right? So, like I was saying, a lot of people person blame someone who's on the streets, saying that, they want to be there, or this is their choice, or they're choosing to be there on the streets, or they're just drug addicts, or it's very dehumanizing perspectives. It's very reductionist, because you're just reducing that person to just, this negative characteristic that, you're calling them. But it's important to build like a critical lens, right? So, going a little bit over like the biological factors, this can include physical health, chronic or acute, right? So someone who has diabetes, how can we get them help, or someone who has any kind of physical health disorders? We want to take that in consideration, right? Because how our body can affect how our mental state is, and then how our mental and physical state could be influenced by our social environment, or the environment in general. So it's important that we look holistically when we're trying to help folks who are on the street. Biological factors can also be substance use disorders, right? So one of the things that I learned outreaching was, one, I work in Boa Heights, Northeast LA, that area. There's a lot of meth, and there's a lot of heroin. Usually in the more affluent areas, there's heroin use. And then in the areas where there's a lot more black folks, there's a lot of meth use, PCP. Meth can damage your organs, and some folks develop like incontinence, which means, they're basically like shitting themselves, or they can't control it, or certain organs are just like taking a lot of damage. So that's going to lead to physical health issues. And then also understanding like the whole brain and how our bodies can become dependent on certain substances is also an important factor, because if you're seeing someone and the layman folk would be like, oh, this person's crazy, and where you can be like, yo, this person has a neurological like disorder, or that was substance induced, that is causing them to behave this way, right? I don't think a lot of folks like actually carry that assumption, but it's important to notice that. Just to give you an example, winning the lottery, this sometimes they say your brain will secrete about 100 nanoliters or 100 deciliters of dopamine, right? So dopamine is this neurotransmitter that induces like pleasure and reward feelings, right? You feel good. You win the lottery, you feel good, right? So that's 100 deciliters of dopamine. And someone who takes meth, their brain is gonna secrete 1,100 deciliters of dopamine. So that's a number that your brain can't normally produce. So how do you expect for someone to just, recover out of like so much chemicals stimulating their brain, especially when there's that extremely high effect, there's going to be extremely low come down, right? So a come down is basically when their brain's like not producing enough dopamine for them to, act what normally folks like kind of experience, which is like you need about 80 deciliters of dopamine to kind of just get up in the morning and go out through your day. But if you used meth, some folk, and that meth lingers in your brain for about 6 months, you might not even get out of bed to even use the restroom. So you might even just shit yourself. You might, you can't even have the critical or the cognitive ability to even just know that you're making this decision, or that you might even have like this as much decision-making power as normal folks would have with a healthy mental health state. So just knowing that substance, use is very critical, and it's not always just the person making that choice. It's the fact that it really inhibits someone's biology. Did you have anything, Joey, you wanted to add to that, or is that kind of okay?
No, that's good. Thank you.
So since I work I'm contracted through the Department of Health Services, I usually work with folks who have chronic health conditions. So again, this could be diabetes, COPD, asthma, arthritis, all of it. And like I said earlier, these folks I would typically, before COVID, I would typically put in a Housing for Health application, which is right here. So Housing for Health, again, these are transitional housing sites for folks with chronic health conditions. If this very severe chronic health conditions, meaning that they need extra care, they need 24-hour 7 days a week kind of service, like this is a facility with nurses and all that, I would submit them for an enriched residential care. Or if they're interested into like a rehab or a detox, I would refer them to like a residential rehab. And usually for folks that are experiencing homelessness, some Housing for Health helps with transitioning them to permanent housing. And sometimes ERC referrals refer them to permanent housing, and then some rehab facilities eventually through time refer them to permanent housing facilities.
Can I add something real quick?
Yes.
So folks, you might be hearing me and Joe and Andrea also saying the terms permanent housing or permanent supportive housing. The difference between the two is that permanent housing is more for folks who are a little more self-sufficient, who don't need additional help to function. Usually it's folks who, I think maybe what we can include in here is also rapid rehousing as well. That's for folks who usually had fallen into homelessness recently. They don't need help learning how to pay their bills online or their rent. You know, they just need a little help getting back on their feet. That would be something like permanent housing. Permanent supportive housing are for folks who need lifelong help. Pretty much will need help because of their chronic illness. Chronic meaning they have a physical illness that's going to be lifelong, that they have to take care of for the rest of their lives, or because of a mental disability. So we might throw those words around pretty often. So just FYI. Abbreviated either PH or PSH.
Yes, there's a lot of like acronyms in this field. And almost in if you're going to get any county job, there's just so many acronyms. ERC, PCP, which is not the drug, but like primary care physician, or HFSP and all that. So again, going over the biopsychosocial model, just saying that there's various services related to this. And I want to just highlight that there's programs specific to like someone with physical health. There's programs specific to people with mental health. And sometimes they're not always interconnected in terms of services. Like there's the Department of Mental Health, which is separate from like the Department of Health Services. So you might have issues with how they're connected, right? Do they communicate together? And I just have a lot of trouble through the bureaucracy of like, yo, I have to like be the liaison between them just so they can communicate, right? I need to get a referral from their mental health therapist in order for them to qualify for maybe a physical health program, or vice versa. So just letting you all know, like, this is the theory, right? That in order to help people, we want to be as holistic as we can, you know, the biopsychosocial model. But when it comes to services, they could be operating in silos, right? And our job as caseworkers and advocates, we're trying to just bring those things together so that our clients can get the best, just recover and stabilize their health. For psychological, again, this means like mental health, cultural, right, or childhood trauma. If anyone's ever heard of the ACEs study, means the Adverse Childhood Experiences Study. It was about 20,000 people, I believe, that they surveyed, and they found that there's direct links, if not strong correlations, with folks who have had extreme or severe like childhood trauma, or leading to, you know, when they become adults, they come out with physical health issues, chronic health issues, mental health disorders, and the like, right? So jumping a little over there. And then the social environmental factors, right? So like the support systems, like the sense of community, you know, how many of you feel like you have a strong community around you? How many of you feel like you have a strong social support system around you? What is sort of like the political climate, right? Is there a lot of folks that are more conservative, liberal, however you want to call it? And how does this influence, like, in terms of access to resources, or lack thereof, right? So, and then there's institutions, and also the social environment encompasses like the rates of like safety, like how safe is your environment, and like what is the rate of violence and all that. but this can be like, this can mean a lot of things too, like even just pollution and all that, and how that affects people's bodies. So a little bit of just in terms of the factors, like what is the framework that we're having when we're trying to help people. All right, let me see. Any questions right now? Anything right now? Anything more things you want to go over? Does that way of splitting up the casework, like in those three categories, is that really holistic in your experience, or does it split up access to super interlinked needs? I think I understand your question a little bit. It's not holistic, you know, completely, because again, like this is very westernized too. So for example, I have folks that are tribal members, or if not, folks that understand their indigenous backgrounds. And if you look up like Department of Mental Health, they have a whole approach to recovery, which I try to do my best to attend these meetings around indigenous mental health. What are certain indigenous mental health models, right? So like the what do I want to call it? The medicine wheel, right? So if you want to look it up, like the medicine wheel in terms of the state of recovery, how does that apply? Because a lot of these programs, you know, they could be faith-based too, right? So if I have someone who, let's say, grew up in a traumatic household and they were very religious, I wouldn't want to like link them up to maybe a faith-based program. Or, you know, let's say it's just a little too, it's just not like that person, like a LGBTQ community. Like I wouldn't want them to link to a faith-based resource. And like that might be the only resource that's in my area. So in that sense, you know, there's not extreme, but there's cultural considerations that we need to take in, and that comes in with like how much rapport do we have with the person experiencing homelessness. All right, let me see if I have another question here. All biopsychosocials are factioned into the workforce services. Okay, great. All right, hopefully, let me know if you guys have any other questions too. Keep throwing them in there. Again, I wish we were all in a circle together kind of going over this. So addressing homelessness in our community, right? I don't know how many of you all ever participated into the homeless count, but if you haven't, it's kind of weird. But it's basically when the community comes together and then they get assigned to look around certain blocks and try to find who's homeless, right? So then all that data gets collected, right? And this is LAHSA, right? The LAHSA website, Los Angeles Homeless Services Authority. There's a lot of information here you can look up if you want to do some investigation, some research. But for the homeless count, this is what it leads to, is this all data, right? We're very data driven. Bureaucracy is a lot of data. But, you know, we're trying to also acknowledge people's humanity, and data doesn't necessarily always reflect that. So here is the homeless count. You can search by community, right? So let's put in maybe Silmar and what comes up. I'm just going to type it in here. Make a search. Oh, I think it's looking in my neighborhood. No, I don't want you to know where I live. So basically, you could look, if you're curious about how many people live in who are experiencing homelessness in Silmar, based off the homeless count, it says about 311 people, right? Data sometimes helps because, you know, you got a lot of folks that want to do the work, but as a community organizer, you know, it's important to also scale the work and have that capacity to do the work, right? Because I got into this job because I was tired of seeing folks that I've seen on the street for years. And I'm like, yo, let me get to the bottom of this. Like, I'm going to get one of these jobs and then try to get these folks in my community off the streets. And also coming in with a mentality where it's like, if I can't help one person get off the streets, then how am I trying to, like, quote unquote, end homelessness, right? And that's the important role that case managers have, is, you know, they're taking it case by case by case. And every case is like unique in its own way. So we also are trying to pull away from overgeneralizing homelessness, oversimplifying it, and really address it in a very humanistic and, like we were talking about, holistic way. So here's the homeless count data. If you're interested in your community, you can look this up, see how many were supposedly counted, how many people in your area are experiencing homelessness.
Can I add something to that real quick?
Yes.
Sorry. One other thing to note about the homeless count, I participated in the one in Pacoima and the one in LA City, but it is a purely visual count. So if there's 4 or 5 people living in one tent, that is considered one person experiencing homelessness. If you see an RV, for example, and there's 5 people living in it, we're supposed to assume that's just one person living in it. It also doesn't capture people who are living in motels, who are couch surfing, or who are possibly living in their cars, because that's not one of the criteria or categories that they count based off of. So although the most recent 2020 homeless count came out to, I think, about 66,000 folks in Los Angeles County, I'm pretty sure it's a lot higher. And V also says that hidden encampments as well. So even when I was doing the homeless count in Pacoima, we had borders in Lakeview Terrace also, near Handsome Dam, if you guys are familiar with that area. We were not allowed to go inside Handsome Dam to go look for any hidden encampments also. So that's a good point to make, thank you. They basically give you a map of places to drive down, and then we're just instructed to look for anything that looks or appears to be an encampment or an RV or something. But that is a very good point, also hidden encampments, especially in the San Fernando Valley. There's a lot of hidden encampments.
Yeah, I outreach like the Highland Park, and there's the 110 freeway, and I go into the river, and I was driving into the river, and I found like whole encampments, like dozens and dozens of people. And I used to outreach Elysian Park as well, and so that also the 110 is also connected there as well. So just underneath the freeway, I found like dozens and dozens of folks, right? And so chances are these people aren't getting counted in the homeless count. So just being aware that these numbers don't necessarily like reflect the total number. So we can estimate like maybe even 100,000 or so. So the next thing that folks could use, if you're just a local concerned community member, is this website called Alley Hop, right? It's not always the friendliest, or it's not always the user-friendliest website. There's some systematic things that we can change, but yeah, I mean, again, this is like probably LA County's like first attempt to actually invest in trying to understand and eradicate homelessness. But here's the website called alleyhop.org. You can pull it up on your phone. You can download it onto your phone desktop, and basically you are able to make a referral. So here you go. So you want to make an outreach request. You want to make a request for an outreach worker or a case manager like myself to come and talk to this person who you're seeing in your local area. Just like anything else, I'm pretty sure we just keep scrolling until we find that button. So when you're trying to make the request, again, you just put your name in, your community or organization, that's optional. How you describe yourself, right? So I'm business owner, government, elected official, and then community resident, and then you have the option to put your number if you want, and then you continue. Once you continue, you'll see a location where you can put in the address, and then you'll have the option of writing a description of how the person looks like. Hopefully, you've engaged the person enough to where you know their name and can put a real good description, because sometimes I get like a referral and it says like man in bush, and I'm like, yo, what am I supposed to do with that? Like I need as outreach workers, as case workers, like be as detailed and specific as you can. Yeah. You got something, Joey?
Yeah, you don't have to know their names. If you don't feel comfortable approaching them, it's okay. Again, like Joe said, be as descriptive as possible. It's also recommended if you see this person in the same intersection often, that helps a lot. You know, we get a lot of requests for folks who are like, hey, I saw this person and, you know, somebody go out there and help them. We go out, but they're gone because, you know, it's not their usual place that they stay. So being as descriptive, like they're wearing red pants, they have a green hat on, they have a beard, they're, you know, even race, like they're black, they're white, they're Asian, whatever, Latino, anything like that. If you can be as descriptive, if, you know, they're in a green tent, and, you know, just be as descriptive as possible. You know, again, if you don't feel comfortable talking to them to find out their name and stuff, and even if they want services, you don't have to, but then also they can self-refer as well. So if they have the ability to, if they have access to a phone or internet or what have you, they can put in their own information and somebody will go out to see them. And turnaround time would be what, like 24, 48 hours, Joe?
Yeah, about that.
Yeah. So you can that. So V asks, is there any chance that entering folks into LA Hop can result in sweeps for that encampment? LA Hop is usually designed just for outreach workers. It's not to report cleanups. Usually you'll see that in, I think, like 211 or 311, I think, when folks like report bulky items. But for this specifically, for LA Hop, it's specifically for outreach workers to engage them and see and connect them to services. Anything
Awesome.
to add? Yeah.
That's a great question. Yeah. No, yeah. Get curious about, you know, why is this the way the system is designed? Because, you know, I like advocating for a more systems thinking approach. For example, you know, these are all strategies that were designed, you know, for those folks that are like the decision makers, the folks that are in these political positions. And sometimes, you know, the perspective of like the community and even the perspective of people experiencing homelessness, they're not at the table coming up with these strategies. So I would always encourage folks to, ask questions, ask why, you know, why is it designed this way? And then how can we make it better?
And the folks making the decisions, the higher up you go, the less melanin there is. So just keep that in mind as well.
Yep. Julio asked, why/how do sweeps end up happening? In my experience, or from what I know, the sweeps are called in by, I don't know, usually like some political, like a council member, you know, has a request, or they get enough local residents who are upset about a certain area, and then, you know, they'll go out with LA Sanitation, or LA Sanitation will be called out with the LAPD to hit up these spots. But I'm sure there's other ways around. Do you have anything, Joe, you want to ask?
Yeah, if you guys want to look up Los Angeles Municipal Code 5611, 56.11, 56.11, it kind of talks about the bulky item. Basically, it's a municipal code that restricts how much items someone experiencing homelessness can have. So again, like it can't be, if it's tied, if they have their tent or their tarps tied to a fence, that's not legal. If they're blocking the sidewalk and there's not enough, what is it, like 3 feet, I think, 3 feet where they can't, where a wheelchair can't access or something, or, yeah, if you want to research it more, definitely check out 5611. Like Joe said, sometimes council members put in the call for sweeps. Also concerned citizens. I've had a lot of concerned citizens do the 311 app to report bulky items. But really it's a person and their belongings. And also I've seen LA Sanitation, like the trash pickup men, actually taking pictures of encampments before they get swept. So I've just seen like big trash pickup what do you call it? Vehicles just taking photos, just driving around taking photos of encampments. Yeah, so that's one of them. Was overturned. So it changes a lot with the 5611. Yes and no. Sometimes, right now, they're not enforcing it as much because of COVID-19. But there is a lot of like back and forth of whether or not they're going to enforce it or not. But as of right now, they are still enforcing it. They're doing sweeps under the guise of 5611. And so correct me if I'm wrong on that one, Joe. I don't know if you guys are still dealing with sweeps.
Yeah, we still do. But not as much as lately, not as much as before. But again, how and why, I mean, that's a whole nother issue we can kind of dive into in terms of trying to advocate for these sweeps. There's a whole hashtag called Services Not Sweeps, which if you're interested in looking up or following, that's Services Not Sweeps. You can check that out. Oh, hold on. Let me try to link that to everyone. Services Not Sweeps. And there's literature out there too, which an organization like Street Watch LA, I went to one of their Street Watch training program workshops where, you know, there's a lot of literature arguing how unconstitutional it is for this municipality code is. And you could get trained on how to film and document when you do witness a street cleaning and how that would be used to essentially be used in court. So if you're interested on that, I'll put Street Watch LA.
One other thing with the sweeps. So they're supposed to have a LAHSA person with them. LA Sanitation should have a LAHSA person. A LAHSA is Los Angeles Homeless Service Administration Authority, something. But they should have a homeless advocate there with them if they're going to have law enforcement there as well. So sometimes I've seen LA Sanitation cleaning up my clients' belongings, and if I don't see LAHSA, I tell them to stop because, and then I cite 5611 to them, like, hey, you're supposed to have a LAHSA person with you. And then once I call them out on it, they usually freak out and then they stop and then they go away. So if you want to get involved in that way.
Yo, thank you for that. I didn't know that. And I rarely see LAHSA or any outreach worker there present. And in an ideal world, I mean, in an ideal world, there wouldn't be these sweeps, but
Yeah.
we don't get any report on when these sweeps are happening, when they occur, which, you know, systematically that would be a better, more efficient route if we as outreach workers, if all outreach workers in that area that's going to get sweeped, if we were informed so that we can be present and better prepare our clients. So
yes. So somebody in the comments also said that LAHSA should be putting up signs of when sweeps are going to happen. That is very true. They have to by law. What I have seen personally is it's kind of really messed up and it's very he said, she said. Like I went to go and see an encampment, talk to my clients, and then the very next day they got swept. And when I came back, all of a sudden there were signs up there saying, hey, we gave you 72-hour notice. I'm like, I was here yesterday and I didn't see any notice. So, and then, so it gets very political the higher up you go. Yeah, just trying to be the best advocate for these folks because who else is going to look out for them, right?
And I could attest to that too. I would be there, and I remember like in Eagle Rock, like I would see signs up the day of when I just had been there the day before and I didn't see no signs. So even though it says 72 hours, I mean, that's going to be blunt. You know, a lot of these politicians don't really give a shit. So, and then in practice, right, there's loopholes and stuff. And then there's just straight out like not following the protocol that is designed to try to help our folks. So yeah, there's that.
And I think I low-key feel like they backdate it too. Like Because then when I argued with them about the streets, the posting not being up, they came back and they were like, no, it was up. Here's a picture of it. And then on it, it said like a date that was like 3 days prior or something. And I was like, there's no way that sign was up. Like, I already know. How do I know you didn't just write that down and then take a picture of it? So, I know, some shady business.
Yeah, we all went to school, when turning in a late homework assignment. It's just stuff like that, that gets away with, in this system. So thank you for that question. It's important to definitely know the rights and know what's being violated, and sort of, what measures we can take to be better advocates. The next resource is like 211, which I don't really use just because, the whole calling and like it's very impersonal and it can be very slow. Do you have any experience with 211? What's it about, Joey?
Yeah, every county has 211. Basically, they have almost everything there. If you need connection to mental health, to substance use, to even to covered California, you can really just call the number 211, and then someone will pick up and you tell them what kind of services you need or what you're looking for, and they'll help direct you. Or you can just 211 Los Angeles, I think, or LA County. I don't remember the exact website, but but that's a resource for sure if you really don't know where to start. Yeah, you can find it by zip code. It is pretty helpful, but then what I find with it is that it doesn't really, like, it'll say, oh, like in this area you're looking for, like, for example, if you're in San Fernando Valley and you're looking for homeless services, they might connect you to LA Family Housing, but they don't really give you the exact number to call. It's just a very general number. And sometimes business hours aren't very accurate. So it's like, so in this case, I would recommend doing the LA Hop to get an outreach worker out to the person you want to get helped.
Yeah. And I think this is why I wanted to put this resource here, because I couldn't find this. I forgot where I got it, but I tried looking all over the internet for this paper right here where I can just directly call an agency in the spa that I might be in, that the person I'm trying to help might be living in. So I'll make this shareable and everything. So if you want a number directly, you can call. And it's good just to call in general and ask questions, get to know the services around you. I mean, that's essentially part of our job as well. It's just knowing all the county services. There's so much. So, if you haven't learned like what DPSS is or what GR is or what homeless services, like numbers to call, like definitely I hope that a lot of you are learning, a little bit about this. So just like, again, we're talking about like the biopsychosocial model earlier. Sometimes your folks haven't been connected to Medi-Cal, right? How do you get them on Medi-Cal? Usually before COVID, we would take folks to like DPSS, which is the Department of Social Services. You can go there in person, just wait in line with the person. We'll wait in line with our clients, ask them, hey, I got someone who wants to get on GR, or I want someone to get on Medi-Cal, right? So this is the one, Adults Without Children. So the Adults Without Children Medi-Cal program provides no cost Medi-Cal benefits to adults. So you can get there, they can fill out the application. Ideally, they would eventually qualify for Medi-Cal. And once they qualify for Medi-Cal, you can link them to a primary care doctor who accepts Medi-Cal, and then you can schedule an appointment for them to finally get like a physical, just like us. I mean, I know a lot of men out there actually don't get health, go to the doctor, which we should. It's very important. And it's very important for everyone to go see the doctor, or at least take care of themselves. But this helps because at least now I'm able to get medical records and document it, because I can't get someone into housing if usually I can't, if I don't have any kind of history documented that they're going to see this doctor who verifies that they have these X, Y, and Z chronic health conditions, right? So this is why, for me, in my experience now, I'm trying to focus more on, like, when I outreach someone, I want to ask them, like, are you connected to a doctor? Like, let's get you connected. Let's get you checked up. Let's get you any medication that you need, and get you connected on Medi-Cal. And then that way, you know, now there's history. And then if a housing opportunity comes, you know, they could get linked to that. So without getting too specific here, just want to throw that out there. And, oh, you got something, Joey?
I was going to say, with all of these, there's a lot of stuff that you can do to help someone experiencing homelessness. I would say maybe the first thing to do is just smile at them, recognize their humanity, you know, say, hi, how are you? But then if you ever build a relationship with them where you want to start doing this stuff and getting them connected to services in this way, helping them get connected to a physician or to a doctor, or getting them some kind of public assistance, it's gonna take time out of your day as well. Like, it's a commitment to help as well. So either connect them to LA Hop, or do an LA Hop request for an outreach worker to do it. Or if you feel you're capable of doing it on your own, I would say to definitely this list that Joe had compiled, definitely look through it and ask questions and see how else you can help. But there's a lot of things that that we as like concerned citizens can do for our neighbors, that don't have to be to this extent also. So yeah.
Exactly. And I think my intentions too with sharing this is that, you know, you can help your family members out as well. And like, for example, my dad, he was having some issues, and I noticed, like, hey, are you even connected to a doctor? And usually folks just go to the ER. And, you know, that's not necessarily the best route, because you want to get connected to a doctor who can track your health and get and keep that going, so they can continuously make appointments and get the adequate care that they need, or that I wanted to get them linked to. So just knowing the county services in general would just help too. If down the line, you know, there's an elderly person that you want to help with, or there's your own family member or friend that you want to get them help with, and they're not on Medi-Cal, you know, definitely here. And just so that we can eventually start talking about, you know, we're going to outreach this Sunday in Sylmar. And I want to kind of get to that. Just briefly, I'll go over this. My Health LA is a program for folks who are undocumented. And if you're interested in that, I'll send a link and all that. You can do some research. This is for a lot of undocumented folks. And then here I have a list of COVID-19 testing sites, substance abuse hotline, right? So sometimes I've had friends even reach out like, hey man, I'm interested in treatment. They can call this number, and it's on the website, and they can talk to someone, see what rehab facilities are available, if there's any detox. And then mental health, right? I wasn't able to find the link online, but fortunately I have a list of Department of Mental Health clinics that you can just call directly. It's really just call directly and ask if, like, hey, I want to start receiving mental health services. And this is divided up in spas. So if you're in a certain area, just look up which spa you're in and you can call. It might not be the most updated, but yeah. This is not only just for folks that you're trying to help that are experiencing homelessness. This could be for yourself. This could be for friends or family members. Calvin asked, what if they have like a criminal record? Would that affect the process for their housing? At the job I work at, there's specific programs called reentry programs, which I should have also listed. Like, that's another population, the reentry folks. These are for folks coming directly out of jail or prison, or folks who are recently left or recently were incarcerated. So we have programs out there too. And if you want to do like alley hop request, that would also help in terms of like, hey, if you happen to know that this person who has a criminal record, they can seek help. Writing that in the alley hop request might actually help with us who get the referrals. Be like, all right, cool, let's refer them to a reentry program. And And there's also, well, I don't want to dive in too much, but yeah, there's reentry. They're called reentry programs. Could you please share the link to the Google Doc again? All right, cool. Let me see if I can put this in the chat box. Did you have anything you wanted to add to that, Joey?
Yeah, I'm sorry I got disconnected, but I think I saw the question about folks with a criminal record, if it affects their housing. Was that the question?
Yeah.
Yes and no. Usually what they're looking for, like if they get a Section 8 voucher, is if they do have any history of like violent crimes, it may impact their housing. Usually it's if they have, if they've been convicted of producing methamphetamines, if they have to register as a sex offender, then yes, it will impact their housing. But otherwise, no, it should be okay. Only because, again, like if they do have to register as a sex offender, then it limits the type of housing that they can access. If the housing is anywhere near a school or near a park or children or what have you, then it will impact their housing. But also getting them connected to, like Joe said, through a reentry program or ODR, Office of Diversion and Reentry. We can also work, they have programs where it'll connect them to legal services to help get their criminal records expunged or sealed. So that is also an option as well.
I'm going to try to make this link public. I thought it was. Maybe it's actually this link. But yeah, thank you for explaining that. Like I said, there's a lot of categories, and hopefully, you know, we're learning more and more about like which categories are out there, which don't exist, which ones we need, and then also like trying to do it in not in such a categorical like perspective, because you know I like learning about the client's stories and really trying to take it through a humanistic perspective as well. All right, let me see. I'm going to share these links when I get a chance. I'll share them. You can also message us. Some of you texted us. Just text us again if you're interested for those links. I'm going to try to make them public. So again, if you're going to do this work or you want to be an advocate or want to help, like we mentioned before, like self-care. What do you do? What is it that you do that you enjoy? Like, because sometimes you don't want to take work with you. You don't want to take all that burden. There's things called like vicarious trauma, where someone telling you a story of their upbringing or the traumatic experiences that they had, it could be very, it could be a lot for you to handle. And, I heard stories of folks where they have nightmares after hearing some certain stories, or they feel it, you have the empathy, you feel it in your body, and you feel, I guess, just so sad or overtaken by the person's experience, that it could be a bit much. And I always try to ask, myself, is my cup full for today? Like, am I mad? Like, did I get enough sleep? And how is that going to affect me when I'm going to work with my client, or how is that going to affect me in my own personal life? Right. So always just take that in consideration. What is your own mental state? What is your own physical state? Are you eating good and all that? Many people in our workspace were kind of been gaining weight. We're taking note of that, and we're trying to figure out ways to exercise and stuff like that. But there's things like stress weight, and there's things like compassion fatigue. So just being aware of that. Let me see. Arthur, I saw that you raised your hand. Did you have anything you wanted to say, or?
Yeah, I wanted to ask. So the 56.11 code, that's the one where Joey was mentioning if there's a sanitation there, but there's no worker with them, that's technically against the code, right?
You
answer that, Joey? I think so. I think that's what you mentioned.
Yes.
Okay.
It is against the code. It'll be a part of, if you look into it further, you may see the words care or care plus mentioned a lot. The name doesn't really mean anything. They used to call it Clean Streets LA, and then they try to rebrand it by calling it Care or Care Plus to make it sound more friendly and less dehumanizing, but it's the same exact thing. They're still dehumanizing folks, but they should have a outreach worker or someone from LASA with them. And if not, if they argue with you, ask to speak with their supervisor, and then they usually will freak out and leave at some point because
Okay,
they
cool.
don't ever want to elevate it up to having to speak to a supervisor.
Okay, that's what I was gonna ask, if like I can like call them out on it. I'm not a worker. I don't have any credentials, so
Yeah, it's
I wanted
definitely.
to see like if my word can carry some weight if I see that happening.
Of course, you will see someone there. You should see someone. You should see someone there with a LAHSA uniform, LAHSA. So they should be accompanying them through these cleanups. If not, then that's when you can raise the issue. But also take care and be safe first. Keep yourself safe before you do. I will research it more as well so I can get the exact guidelines on it, and then I'll send it to you privately later.
Cool. Thank you.
Awesome. And thank you for sharing that, Jay. He put this quote, or they put this quote that says, the result of the intervention reflect the internal condition of the intervener. And again, reflecting on our healthy boundaries, right? So as caseworkers, we can be the person, or as advocates too, we can be the person that whoever you're trying to help you might be the only person there that's able to help them out, or in a healthy way, in a way we're not trying to manipulate them, or because we have this position of a power as well. We're able to get them off the streets, but we also be aware that those boundaries as well, like how much today can you put effort in, and also meeting them where they're at, right? So not all the time is the person you're working with or you're trying to help is going to say something or do something that you're like, hey, you should get into rehab. You got to meet them where they're at. Like if they're not ready yet, I mean, that's the whole importance of like rapport building. And in general, like you're not here trying to give your own advice. You really want to have them like ideally like request it or be there when it's needed and be there when you're ready. So with that, I also emphasize like the idea of like a safety plan, right? So talking about them like, hey, what is it that you've noticed, whenever you feel angry or whenever you want to use, and this is again, like if you're eventually in that relationship with the person, you have that rapport, where you're able to have these conversations, right? Safety plan is always important. I've learned this through domestic violence training, where, you want to at least have someone go through that thought process of like, what is it that I should have prepared in case I'm like, I'm ready to leave this relationship, or I'm ready to get into rehab, or I'm ready to get into mental health services or anything, that they at least you've helped them through dialogue, talk through it and really go over it. All right, I'm going to have my clothes ready, or I have a number I can call or anything like that. So again, this is not just for folks experiencing homelessness. This is also like if you have friends or family members or even yourself, just some toolkits out here. And here's a good resource too, because, we also want to take a trauma-informed care approach. This is something I pulled up. This is SAMHSA, right? So it stands for the, here, let me put it up right here. It's the Substance Abuse Mental Health Services Administration. You could go on the website, a lot of information out there, great material to read. This is from a slide on trauma-informed care. Again, defining trauma. Individual trauma results from an event, a series of events, or set of circumstances that is experienced by an individual as physical or emotional harm, or harmful or threatening, and that has lasting adverse effects on the individual's functioning, their physical, social, emotional, or spiritual well-being, right? So this little diagram says like, something bad happens to you, but then there's also a harmful experience, right? Like, so let's say I mean, usually for me, like if a police is called, sometimes the police make a bad situation even worse. And there could be lasting effects, right? So either, there's some police brutality, or even going through like a court system, right, through a domestic violence situation that could also lead to like lasting effects. Like it could lead to like chronic, like ongoing trauma. So I can share this as well if folks are interested in this whole slideshow. It's a really good slideshow that covers child, adult, family. Yeah, so SAMHSA, definitely if you're interested in more. Okay. Joey, do you have anything you would like to add in the meantime?
No, I'm good. Thank you.
Cool. All right, so some folks, just keep mindful of times, about 8:50. It's routine that these conversations last longer, and there's a lot to share, and we really wanted to come up with something that is very cohesive, a very well thought of, that can help you guys, develop the skill set and the knowledge to, take a next step in terms of advocating for people experiencing on the streets. Quickly, I did share some stories of where community support helped with outreach workers. Like I said, there was a church that helped take in one of my clients. They built showers for him, and this was a number of clients actually. And through that, through my relationship with the pastor, I'm not religious myself, just throwing that out there, but through that relationship, I was able to link the person to services while they were safe. And then now I got about 3 people housed through that one church. And that helped immensely because, having that safety, right? When we talk about trauma, when we talk about in general, like trauma-informed care, or just in general of health, safety is important. And when people experience trauma, it feels like the loss of safety, the loss of ever being safe again. So definitely, there's a lot of stories. Recently, I had someone where a local activist space actually took her in overnight, and I was able to do a referral because she was having issues at the encampment that she was at. I was able to put in a referral for her to get into transitional housing. And because of that immediate situation where she didn't feel safe, she didn't really know what to do. It helped me because we don't have any facilities where I can immediately take them in, but a local activist space allowed her to stay there overnight. I made the referral, and then the next morning I picked her up and I was able to take her to her intake appointment so that she can get into a transitional housing site. So definitely, there's county resources, and then there's community people that step up and are willing to, provide that need that me as a caseworker can help better serve my clients. There's also some volunteer opportunities. I just want to do some shout out. Like I said, Showers of Hope. Showers of Hope, they provide showers all around LA County. Feel free to volunteer there. On their website, you can look up locations and everything. If you're interested, this is sort of where I started. The church actually that I was referencing that helped my client, a few of my clients stay there. I met them through volunteering with the Showers of Hope. And because of that, we're developing relationships and friendships. And I think that's just sort of the lacking in county services, is that, we're actually trying to cultivate community too. K-Town for All is another great organization. They actually do outreach and a lot more than just outreach. They do a lot of like political organizing and everything. So if you're interested in getting involved, check them out, K-Town for All. And then Street Watch LA, another great organization that does a lot of direct action work. You can actually learn how to document. You can learn about like the 56.11 municipality code. You can learn like the rights. You can learn how to film the police and everything, and make sure that, if you want to take that route, go ahead, learn that skill. We're all in this together. Like I said in the beginning, it takes a village. Is there any other, if you have any other resources you want to share, feel free to type it in the chat box. And then Kelvin asked, should we just reach out to you for those Google Docs or on LASA? Not entirely sure what you're referencing, but I mean, Kelvin, I know you personally, so you can always just message me. And And I'll share this whole document too. Like, I do plan on sharing that. If you're interested in working, like, I just listed some of this here, but if you're interested in getting a job that we're doing, there's positions like community health worker and peer specialist, and I'm sure there's many more. These are entry level, so you don't really need a degree. Just need that passion, and you need this passion. Like, obviously, we're not doing this for the money because, you know, it's not, you're not gonna be a billionaire from this. But again, you're able to help communities. You're able to help communities directly learn. There's also case managers, right, or care managers, which is my position now, because and so, you know, this is like usually a bachelor's or some bachelor's degree, but you can actually be promoted from like a care community health worker, peer specialist, and possibly be promoted to a case manager. And then those who are going to school, you know, if you want to go into school for MFT, marriage and family therapist, or a social work degree, a lot of our teams have mental health clinicians, and that will be a chance for you if you want to work in this field. Definitely, you know, get that degree. You'll be a valuable asset, because you'll be able to help link folks directly, right? So I don't have the power to link folks to vital mental health services, but those who have license and all that, you know, they do. And then if you're a nurse, you can definitely work in this field as well. You know, LVN or RN, you can work in this field and be able to bring your tool set of the understanding of physical health to help our folks on the streets. And I'm sure there's more. So lastly, you know, what we want to talk about is that we're going to be outreaching this Sunday in Silmar. So based off all this information, Julio or Joey or Calvin or Andrea, if you're able to jump in, what is something that you're interested in doing during this outreach? And if anyone else here is just kind of came in here to learn about the information, you know, feel free to jump out. We're actually going to try to spend this time now to think about Sunday. This Sunday, we're going to outreach. If you want to join in or even just be a part of this conversation, we're just going to kind of figure out the logistics. So anyone, yeah.
Real quick, Jesse had posted another great resource in the chats with the LA Tenants Union. I was going to say, yes, they're great. Not only do they have a working group with for the unhoused, but they also do a lot of tenant rights workshops as well. So a lot of prevention of homelessness prevention. So even like telling teaching your neighbors, you know, you can't get evicted if it's not for these 14 reasons, you know, or there's a lot of, and what's the other one? Housing workshop. I have to look it up, but they do a lot of workshops where they teach folks that are renters what their rights are, so they don't get evicted and possibly face homelessness as well. So not only do we want to tackle homelessness where it's at right now, but also how do we prevent it from happening for anyone else as well? I think I saw a question. What was the Measure H bill you mentioned in the beginning? Measure H was a bill that was passed in, I think, 2016 that funds basically mine and Joe's job for outreach services and homeless services as well. That's like the very, very gist of it, a very simplified explanation. Do you want to share on Measure H, Joe, or anything?
Yeah, so it was a bill, I guess 2016, I got approved, $1.3 billion, I believe, and that funding helped with providing services. So, you know, this is how essentially we're getting paid. And it's always funny because I started as an activist and like eventually advocating for a future job that I was able to get. But yeah, then there's the whole E6 strategies. There's this whole strategy that you can look up, Measure H, where there's different teams, different programs where all the funding is going towards. So if you're interested in learning about that, you can Google all that information there.
Yeah. Think of it as Measure H is basically an approval for additional tax money. So it is taxpayers who are funding these positions for outreach services, for homeless services.
Great questions.
Yeah, awesome. Any other questions folks might have? Cool. Awesome. So, yeah, I guess Julio or Calvin, if you guys want to chime in and see how Sunday might look like, is there any questions or anything in mind you want to share, or see how we can strategize for the Sunday?
Well, yeah, like I mentioned, most just like, cause it's kind of, cause most of the places that, well, the place that I'm thinking of, there's like maybe 10 mobile homes about, and so